Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Naha Balata from Roots Community Health Center, reporting for the week of July 10th, 2023. After a brief update on COVID status, I'll talk about a new study on antigen testing and a new advance in COVID detection. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Taking a look at the CDC COVID data tracker, we can see that there have been 6,220 COVID hospital admissions in the week ending July 1st. That has been pretty flat, decreasing less than 1% over 1 month's time. Deaths continue to trend down, and of all deaths nationwide, COVID represented 1% of those deaths. This is variable though. All of the states that were reporting in reported less than 2% of their total deaths were due to COVID, with the exception of Puerto Rico, where in the past week, 8% of the deaths were due to COVID, and that represented a 63% increase from the week before. So this is just something that we will continue to keep an eye on. So far in the United States, 1,137,053 people have lost their lives to COVID-19. 42,055 of those were in this year, 2023. In the week ending June 10th, which is the last week where we have confirmed numbers, there were 522 deaths. And that represents the 10th week in a row with declining death numbers. So this is indeed good news.
Taking a look at wastewater, we can still see that there are large areas of the country that don't have wastewater sites reporting on SARS-CoV-2, but new sites do continue to be added. This view is taking a look at the percent change in wastewater concentration over the last 15 days. So if this is something you're interested in, you can take a look at your state or even your county, and you can zoom in on the wastewater sites that may be closest to you and get a picture of what's been going on. So for example, this particular wastewater treatment plant is showing a pretty sharp increase. So if you live in this area, that may be of significance to you. So at this point, really looking at the wastewater seems to be most useful on a very granular level within your neighborhood. So the link to this map is in the post, may be worth checking out.
Taking a look at variant proportions, we can see that we have a new variant on the scene. It's called EG5. I know EG.5 sounds quite different from the other ones, but rest assured, this is still part of the Omicron family. EG.5 is actually an alias for XBB.1.9.2.5. I guess that's just too long, so they shortened it to EG.5. And you can see here that it is derived from XBB.1.9.2. Haven't seen a lot of information about EG.5 so far, other than it seemed to first come on the scene in Indonesia. It's been here in the United States for a couple months, and it is increasing while some of the other XBBs continue to decrease. So it does seem to have some growth advantage, and you can see here, it's the orange color. It's most predominant in kind of the middle of the United States, regions 7 and 8. But again, nothing to report yet about any big differences in severity, etc. And as I reported a couple of weeks ago, we are expecting that the new boosters coming out in the fall will be against XBB. So far, so good on that front, but we will need to wait and see what variants are prevalent when the time comes. Because as much as we say we don't want to be chasing variants, that's exactly what we are doing until we get a better vaccine strategy. So this is definitely something we'll also continue to watch. A couple of weeks ago, I shared with you this campaign demanding free PCR tests for all, and there have already been over 16,000 letters submitted, and there seems to be some traction, which is great news, though it's still not enough. So if you're inclined, please check out the link in the post to add your name and your comments to this effort. In terms of the progress, Walgreens, along with the Department of Health and Human Services, rolled out a free PCR program at 1,000 of their sites. The link is in the post. You can put in your zip code, see if there's anything in your vicinity. There are definitely several caveats to this program, like if you have insurance, they may bill the insurance, or you may be charged. But if you qualify for a free test, you can get it for free. They're saying that the turnaround time is 48 hours. So we know that PCR tests can be very important in multiple scenarios, actually, but most importantly, when you really need to get it right. So for example, if you're someone who would need to be treated, if you're positive, it is more definitive and faster or sooner that you would get a positive PCR. So if you have symptoms, or definitely if you were exposed, PCR is going to be your most reliable and definitive test, because the rapid antigen test takes longer to turn positive and they do need to be repeated. And I'm going to be reviewing some data on this in a moment. PCR tests are also important so that you can have documentation of infection just in case, and hopefully you won't need it, but just in case you did need it for like time off or disability, having proof is important. But the bottom line here is you shouldn't wait until you're exposed or have symptoms to figure out where you're going to be able to get tested. If you have a primary care doctor, please inquire with them now, just to find out if they are doing testing. Any primary care doctor does conduct respiratory swabs, and they can send them out for a number of things, SARS-CoV-2 included. So this isn't something that they should be opting out of, but they may have other arrangements like with local urgent cares or so on, and they may have other direction they want to give you, but this is their responsibility. So if they're your primary care doctor, please advocate for yourself, find out what the process is going to be in the event that you need this test. So the Walgreens program is definitely not enough, but it is there, hoping to see it expanded, hoping to see more options become available. This Walgreens option may or may not be in your area, but it's worth checking out just to see if it might be a viable option for you. But first and foremost is checking in with your primary care provider. And if you don't have one, please get one. So now I want to review this article that recently came out in the Annals of Internal Medicine called Performance of Rapid Antigen Tests to Detect Symptomatic and Asymptomatic SARS-CoV-2 Infection. Now, there are several different antigen tests, as we know, on the market, and they are authorized through emergency use. And we know that they can be a useful tool when used at the right time in the right scenarios. But the truth is we don't have a whole lot of data on how they are performing in the real world. And we would really like more data on how they're performing in the real world. But I think this is a good start. So I like this study because it looked at both antigen tests and PCR in the same individuals. And it also looked at repeat antigen tests in those same individuals. And I think overall it confirms what more or less what we know, but it's definitely nice to see some data and kind of get our arms around what it's really telling us. I also like that they kind of replicated what we would expect to see in real life, in that the samples were collected by the patients at home, just like they normally would for the antigen testing. So this didn't involve going into a lab or a testing site, which means that there's going to be some variability, but that's what we're seeing in real life as well in terms of how people are collecting specimens and doing the tests and so on. So for purposes of answering these questions about the performance of home tests, I thought that it was helpful that they actually kind of replicated what we're experiencing in real life. So this study looked between October 2021 and January 2022. So that spans kind of both Delta and Omicron periods. And they had people enroll through an app, and it was folks all across the country basically enrolling online and using this app. And they had patients perform home tests as well as collect a specimen that was sent in prepaid envelopes through FedEx for PCR. They used 3 different types of antigen tests, but this it wasn't designed to be a head-to-head comparison of the different tests. They just wanted to include different brands so that they wouldn't be only testing one brand. And they found that there weren't major differences between the brands, so they ended up reporting out in aggregate. They had participants do nasal swabs for home testing and then sending them in. And the home testing, they had patients repeat every 48 hours. And they also asked the patients about whether they had symptoms or not so that they could see if there was a difference in performance between patients with or without symptoms. So they identified 5,353 participants who were eligible for the analysis, and that included a total of 42,130 days of testing. About 13% of the participants were not vaccinated. So we've got both vaccinated and unvaccinated in the study. And there was a few important findings, I thought. First is that antigen tests were far more sensitive with repeat testing. I think we know this, but they were able to do some quantifying here. Also, they are significantly more effective among patients who have symptoms. So what they found is that the antigen tests were accurate 82.5% of the time in patients with symptoms for a single test, but then with serial testing, it got even better, where the sensitivity was 93.4% when the test was done twice. And with 3-time testing, the sensitivity went up to 94.3%. Now remember, sensitivity has to do with how good the test is at correctly identifying a positive result. So if you have symptoms and you repeat the test 3 times, the sensitivity or the ability to pick up that positive is very high at 94.3%. Now these were tests done every 48 hours. They did not test at any other intervals other than 48 hours. But this is still very reassuring. Even with the 2 tests and someone with symptoms, you're still over 93% sensitive. So this is quite reassuring. Now, when we're talking about people who have no symptoms, the sensitivity does drop quite a bit. So this is definitely something to think about depending on how you're using these antigen tests. So particularly if you're using them after exposure, but also if we're using them prior to a gathering. We just want to keep all of this in context. So what they found here was that people who did not have symptoms, for them, the sensitivity of a single test was 34.4%. And with 2 tests was 55.3%. But it did go up to 68.5% sensitivity during the first week of infection when 3 tests were done. So again, these are people that we now know were positive because they had a PCR test. The sensitivity of those home tests was 68.5% if they did 3 tests 48 hours apart. So this is not great, but 68.5% when you've repeated it 3 times is helpful, not definitive. They did go further to take a closer look at the PCR test, though, and kind of see just how positive they are. So without getting into too much detail here, when we look at PCR tests, we can tell if someone has sort of relatively more or less viral copies of SARS-CoV-2 in the specimen based on how many cycles we have to run the test. So if you have to run a lot of cycles, that means there was less virus there to detect. So they were able to note that those with the higher cycle time, so again, meaning less virus, that the antigen test was more likely to come out negative. So this is kind of confirming what we already know, but it does provide us some good data to consider. And it lets us know that if there's not a lot of viral copies, that's when the antigen test is more likely to be negative. And that usually means not as contagious. But of course, that wasn't part of this study. So we don't know the clinical implications, but again, we can kind of infer, from this that if you got a lot of viral copies in the nose and the specimen, then your antigen test is more likely to be positive. And they did look at a number of different scenarios with a lot of different nuances. So if you're interested in this, the link is in the post. You can check out the article. But I think what came through loud and clear was that if you have symptoms, then you should repeat your test at least, so do at least 2 tests, ideally 3, and then you'll see high accuracy up in the 94% range. With just one test, it was 82%. So I think it's worth definitely repeating 2 to 3 times just to get up into that 94% range. If you don't have any symptoms, then you really have to do 3 tests to get into any kind of, respectable range here. And even then, the sensitivity looks to be a little under 70%. Now, again, the study only looked at the 48-hour spacing, so that does not mean that that's the right interval. It's just the one that they used here. In general, I think this is a reasonable strategy, except in the scenario I mentioned before, where if you're someone who needs to be treated, then you really probably don't have time to be doing these 3 tests 48 hours apart, because you got to start your treatment within 5 days, and the sooner the better. So in that case, you really would want to seek out that PCR test so that you can get started on treatment right away. Also, if you think you were exposed and you do decide to go this route of repeat antigen testing, let's say you're not someone who needs to be treated, but you still need to know because you don't want to be spreading it to others. So please, just if you decide to go this route of repeat testing every 48 hours for 3 tests, please don't go around anyone who's vulnerable in the meantime. If you absolutely need to be around others, please wear a well-fitted N95 mask. This is considered source control. And if you're testing negative and you're wearing an N95 mask as source control and you're repeating every 48 hours, then I think this can be a reasonable strategy. But again, kind of a minimum of 3 tests, I think, would be warranted here. And wearing that N95 is absolutely critical so that you can keep from harming another person. And if we're talking about pre-gathering testing, so now pre-gathering testing, now that's just going to be 1 test typically. And so if you have no symptoms and you're just doing 1 test right before the gathering, it is going to miss some people who will eventually become positive. But I think the good news, and kind of as I've alluded to with this cycle time comparison, is that the likelihood is that if someone is testing negative, even if they're going to turn positive later, at least in that moment, there's not a lot of virus present in the nose of those people. So if you do the test immediately before the gathering, and it's not an extremely long gathering, and the specimen was collected properly, and this is a person without symptoms, it's unlikely that they will become very contagious during the course of that event. No guarantees. But if it's a longer event or an event that spans multiple days, it would be advisable to repeat testing daily. And of course, in this situation, given this lower sensitivity that we know about in this scenario, it's just 1 layer. So we're going to want to use the other layers of protection that we know about, like gathering outside, wearing a mask, and so on. So the antigen test in this scenario is definitely just 1 layer. It's a helpful layer, especially if it's positive. But if it's negative, as we can see, there's still certainly a chance that that person has SARS-CoV-2. So still need to exercise some vigilance. And I'll say it again, if you're someone who should be treated, if you test positive for SARS-CoV-2, then you really need to know as soon as possible if you're positive. Most of the treatments have to be started within 5 days. Here's the chart of our current outpatient SARS-CoV-2 treatment. Paxlovid still considered first line in most everyone 12 and up. Especially if there's no reason why they can't take it. We know that there are some people who are on medications that may make it a little difficult. We'll have to then hold some of those medications. Every now and then we have someone who really cannot take Paxlovid because of an underlying condition or because of a medication that they cannot stop. In this case, remdesivir is an excellent 2nd-line choice. The problem with remdesivir is that it's given IV, and ever since the ending of the emergency declaration, we are having a very difficult time finding out where we can send patients for outpatient remdesivir. So this is a definite gap right now. We say we have the tools, but if we can't access the tools, then they're no use. So this is something that really needs to be addressed. We will continue to look for resources and report back if and when we identify them. 3rd line is molnupiravir. Not terribly effective, but in most cases, it is going to be better than nothing if we really cannot get Paxlovid or remdesivir. So this is something to consider. And if you're someone who's immunocompromised, then you may be eligible for high titer convalescent plasma. I reviewed this in a lot of detail 2 weeks ago in case you're interested. But as I've been saying week after week, you need to have a plan ahead of time. If you're someone who should be treated, and the list of who that is in the post. And there's a lot of underlying conditions that actually could qualify you for treatment, but basically anyone 50 years and up or with underlying conditions, please speak to your physician about what you should do if you catch COVID. And if you don't have a primary care provider, please get one. And lastly, I want to share this article from Nature Communications published on July 10th. And it's real-time environmental surveillance of SARS-CoV-2 aerosols. And this was just an interesting proof of concept on a monitor that can detect SARS-CoV-2 aerosol in the air within 5 minutes. And you can see the device here. It's relatively compact, and it tests the ambient air for the presence of SARS-CoV-2. And when the air comes out, it goes through a HEPA filtration or HEPA filter, so clean air is coming from the outlet. And this is a very interesting device that may have some potential uses out there. And they even state that it doesn't have to just be for SARS-CoV-2. They could be testing flu, RSV, or other things as well. And so I'm cautiously optimistic about this. You might recall that I very enthusiastically reported over a year ago about a breathalyzer that was approved by the FDA, but it never made it to market. This device seems like it might be a little more promising because it seems cheaper to make. The main drawback that they noted is that it is kind of loud. I think there's going to need to be some real thought put into how this would work in the real world, like how you would handle the situation if there's a positive result, let's say in a crowded room at an event or something like that. But I am feeling optimistic that folks are working on innovations like this, and I am hopeful that it's something that can be made available, especially in some of the settings we're more worried about, like skilled nursing facilities and other congregate settings. Also, I would love to see technology like this in schools or workplaces or any other settings where quick action can prevent outbreaks that can end up creating multiple other new lines of transmission and continue the spread of SARS-CoV-2. So I think really putting some thought into how this kind of technology would be used will be useful. But I did think this was hopeful. Now, in conclusion, I'm glad to be able to continue reporting a continued downward trend of deaths and somewhat flat downward trend of hospitalizations, but there still is quite a lot of SARS-CoV-2 circulating in our environment. We've still got new variants popping up. We're still in an evolving situation. We're still learning about the effects of repeat infections. We're still learning about post-COVID events and long COVID as well. What we do know is that following COVID, we're seeing phenomena that can really be affecting just about every or any organ system in the body. We're seeing increased diabetes, worsening control of diabetes, worsening control of asthma. We're seeing blood clots and heart attacks, strokes, not in everyone, but we still can't predict who. And we also know that if you caught COVID once and did fine, that is not a guarantee about the next time. Every infection is a new opportunity, may even be a compounded opportunity for long COVID and post-COVID impacts. So please do what you can to avoid getting infected or reinfected and avoid spreading it to others. Let's keep up our best practices to prevent the spread of COVID and to prevent outbreaks. Stay up to date on vaccination. Next week, I'm going to get into a little more about what that actually means in this moment. Wear a high quality filtration mask like an N95, KN95, or KF94, especially if you are indoors with others. And very importantly, if you are going to be indoors with others, you want to make sure there's good ventilation and filtration. You can assess ventilation using a CO2 monitor. Limit your time indoors, limit the amount of mixing that you're doing indoors. Whenever possible, gather outside. And if you are going to be gathering indoors, you may also consider implementing pre-gathering testing as another layer of protection. And again, if you're someone who should be treated, if you catch COVID, then you should know that in advance and you should have a treatment plan with your provider. Treatment can reduce the risk of hospitalization and death by about 80% if you start on time. And we're still losing over 2,000 people per month to COVID in the United States alone. So it is definitely not done with us yet. And starting treatment on time means you have to test on time. So know where you can get tested. And if you're so inclined, join the advocacy efforts underway to ensure free PCR testing for all. Again, that link is in the post. And if you do not feel well, please stay home and rest. Don't spread what you've got to others. And as always, remember to eat a balanced diet, incorporate fruits and vegetables and whole grains. Let's avoid those sugary drinks. Consider a multivitamin supplement. Get your blood pressure and your baseline labs checked, like your sugar and your cholesterol and your vitamin D. If you don't have a primary care doctor or if you have not seen them, go ahead and make an appointment to establish care. Don't wait till something's wrong. Meet them, get to know them, get your labs checked if that's what's indicated, find out what's appropriate for your age that you need to have done. And please get some regular physical activity, unless, of course, you're sick. In that case, please get your rest, manage your stress levels, and get a good night's sleep. This concludes today's People's Health Briefing. Thank you so much for joining us. We'll see you again next Tuesday at 10 a.m.